When someone on the team isn't performing, almost every manager reaches for the same explanation. They're not motivated. They don't care enough. They need to take more responsibility and ownership. They just don't have the drive. In 40 years that I've been working in corporate America, that was almost never the actual problem. And the danger of jumping to motivation is that once you decide somebody doesn't care, you start managing them differently. You become less patient, less curious, more suspicious. You stop coaching and start documenting. And sometimes you end up disciplining somebody for a problem they were never actually equipped to solve. When performance drops, I use a very simple diagnostic, 3 C's: capability, clarity, and commitment. And the order matters because commitment should be the last thing you diagnose, not the first. Capability, can they actually do the job? Start with capability. Does this person have the knowledge, skill, experience, tools, or judgment required to perform the work? Now that sounds obvious, but managers skip it all the time. Someone misses a deadline and we say, they need to manage their time better. Maybe. Or maybe they were never taught how to estimate the work. Someone gives a weak presentation, we say they lack executive presence, maybe. Or maybe they've never been coached on how to present to senior leaders. Someone keeps making errors in a process, we call them careless, maybe. Or maybe the process changed 3 months ago and nobody properly trained them. This is an important distinction. If someone cannot do something, treating the problem as though they will not do it or will never be able to do it is not going to fix anything. You can hold them more accountable, you can send them more emails, you can tell them how important it is, you can put them on a performance improvement plan. None of that creates skill. If I put you in front of a piano and tell you that your annual bonus depends on you playing Beethoven, motivation will not be the issue. You need capability. So before you label a person an underperformer, ask, have they ever successfully demonstrated that skill? Have we actually taught them how to do it? Have they had enough practice? Did the job change? Did the level of complexity increase? Are we asking them to operate at a level they have never operated at before? And do they have the tools and resources needed? Because if the answer is no, you don't have a discipline problem. You have a development problem. And those require completely different management responses. Clarity. Do they know what good looks like? The second C is clarity. And this is where I think a huge percentage of supposed performance problems actually live. Managers believe they have been clear because they said something. That's not the same as clarity. Take more ownership. What does that mean? Be more strategic. Well, what does strategic look like in this job? Communicate better. How? Be more proactive. About what? Step up. Into what? These phrases make perfect sense to the manager saying them because the manager already has a picture in their head of what good looks like. The employee does not necessarily have that picture. I've seen managers become incredibly frustrated with people for failing to meet expectations that were never made observable. If I tell you I need this report to be better, I have given you nothing to act on. If I say I need this report to be 1 page, start with the recommendation, include the 3 numbers that support it, identify the risk, and tell me what decision you need from me now, that is clarity. That person can go execute. And clarity also means priorities. You cannot tell an employee that everything is urgent and then criticize them for choosing the wrong thing first. You cannot give somebody 5 objectives and then quietly believe that one of them matters 3 times more than the others. And you cannot change your expectations every week and then call somebody else inconsistent. Before you conclude that a person is failing, ask yourself, could they explain that back to me exactly what success looks like? Could they tell me the top 2 or 3 things that matter most? Do they know how I will evaluate the work? Do they understand what good looks like? Not just what the task is. Because assigning work is not the same thing as defining performance. And many employees who look unmotivated are actually confused. They're working, They just aren't working toward the picture that exists in their manager's head. Only after capability and clarity have been addressed do we get to the third C, and that's commitment. This is the question managers usually start with. Do they care? Are they willing to do the work? Are they choosing not to meet an expectation they understand and are capable of meeting? That problem does exist. There are employees who know exactly what is expected. They have the skills, they have the resources, they have been giving feedback, and they still choose not to perform. At that point, you have a commitment problem, and accountability is appropriate. But notice how much work we had to do before we got there. We had to rule out inability. We ruled out ambiguity. We made sure the person knew the standard. We made sure the standard was reasonable. We made sure they had the tools and the capability to reach it. Now, if performance still does not change, the conversation becomes a lot more direct. You understand the expectation. You've demonstrated that you're capable of doing this. We've discussed what needs to change, and it's still not happening. Help me understand why. That's a fair conversation. And if there's no legitimate barrier and the person simply chooses not to meet the expectations, then yes, there may need to be some consequences. But now you are responding to the right diagnosis. So, why do managers start with commitment? Why is they're just not motivated is such an attractive explanation. Because commitment is the only one of the three that lets the manager completely off the hook. Think about it. If the problem is capability, the manager has to ask, did we hire correctly? Did we train this person? Did I coach them? Did I give them enough time to learn? If the problem is clarity, the manager has to ask, was I clear? Did I define the standard? Did I set priorities? Did I give useful feedback? Did I change the expectation without explaining it? But if the problem is commitment, oh, that's easy. It's them. They don't care. They have a bad attitude. They lack ownership. They're not hungry enough. That diagnosis requires almost no self-examination from the manager, and that is precisely why you should be suspicious of it. Not because every performance problem is the manager's fault. It isn't. Adults are responsible for their own choices. Some people genuinely will not do what the job requires. But a manager has a responsibility to rule out the conditions they control before assigning the problem entirely to someone's character. Because lazy is not a useful diagnosis. Neither is unmotivated. Those are conclusions. And a good manager gets underneath them. What do you actually say when somebody is underperforming? You do not need a complicated process. Ask the question in the same order as the model. Start with capability. You might say, I've noticed we're struggling with X. Walk me through how you're approaching it. Then listen. Do not immediately correct them. You are trying to understand whether they know how to do the work. Ask, what part of this feels difficult? Is there anything you haven't been trained on? Have you done this kind of work successfully before? What would help you execute this more consistently? Now move to clarity. Ask, tell me what you believe the expectation is. That question alone can tell you a lot. Not, do you understand? We're going to say yes. Ask them to explain it. What does a successful result look like to you in this job? What do you believe the top priority is? How are you deciding what to do first? What do you think I'm looking for here? If their answer doesn't match what's in your head, you've just found the gap. And now, only after those two areas are clear do you move to commitment. You know what success looks like. You have the ability and resources to do it. Is there anything getting in the way of your willingness to meet this expectation? That's a much different question than, why aren't you motivated? It gives an employee an opportunity to tell you something you may not know. Maybe they disagree with the approach. Maybe there's a workload issue. Maybe there's a conflict you haven't seen. Maybe they are disengaged. Maybe they are avoiding something. Or maybe, after all of that, they simply are not willing to do what the role requires. Now you know, and whatever action you take next is based on information rather than assumption. Performance management gets much easier when you stop trying to read people's minds. Do not start with they don't care. Start with can they do it? Do they know exactly what good looks like? And only then are they willing to do it. Capability, clarity, commitment in that order, because the wrong diagnosis leads to the wrong treatment. And if you treat a training problem like an attitude problem, you will probably make both the performance and the relationship worse. Diagnose before you prescribe. You'd expect that from a doctor, and your team deserves that from you. For more leadership insights, hit the subscribe button.